no harm, no foul, because you always want to give your body a chance to heal first. Your body's amazing ability to heal on its own. It's amazing, right? But you have to give it an environment to heal. And you have to stop what you did to get it there, right? So you flip that, you get in musculoskeletal expert, you work with some nutrition, you work with some supplementation. Now, if that doesn't work, then you can start to triage up the chain, which is more expensive, more invasive, more, things that potentially are going to be long-term lasting effects, but are significantly invasive. But when you look at the health changes, the physical therapy changes, those are least invasive, and long-term prognosis, research shows significant good prognosis in relation to surgery, injection, and all of it.
Welcome back to a Rest, Eat, Move podcast. And today I have an amazing guest, Jill Marlan. She is owner of Peak Performance Physical Therapy. And I've got to know Jill for the last handful of years. But more importantly, I started having some hamstring issues. And I kept thinking about, and I saw her speaking one day at Playmakers. Her and I were doing an event locally. And I thought to myself, of all the people, I want to go see her. And she really opened my eyes up about what's going on in my body. And I got to tell you, from a really honest point of view, I don't think my back has felt this good in 25 years.
Yeah,
So I just got back from skiing in Colorado. And every morning I got up and I'm like, wow, my back feels so good. So a lot of that decompression stuff we did for the spine, you had me work on my mobility of my hips, and we're not done. I know we're not done.
Right, yeah.
But anyway, just that's kind of a little intro from there. But firsthand, I could feel the amazing expertise that you've had over time. So anyway, welcome to spending the time with us today. And I want to begin just a little bit about yourself, your business, how you got started in this field, and toot your horn a little bit, because you have tons and tons of experience and knowledge in this space.
Well, thank you so much for having me. I really appreciate being here and having this conversation with you, and always love to talk with people in our community that are experts and leaders within their field. And Chris, you certainly are. And, looking around us here of the tremendous books that you've written and the influence that you've had in the field of health and wellness is tremendous. And that's something, our mission at Peak Performance is really increasing that human connection through health and wellness. And, that's where, we can work really well together. And so I think that's why our philosophies work well together.
Sure. Yeah.
And how we kind of really have come together. So, yeah, a little bit about me and Peak Performance and what that looks like. And, I started as a college athlete. So I went through college on a full ride basketball scholarship, and I grew up in the gym in a locker room and been an athlete myself. And originally was going in veterinary medicine and pivoted, transitioned after an injury, and have had my fair share of injuries that I have recovered from and, maneuvered through, and through the help of phenomenal physical therapists. And I transitioned from veterinary medicine to physical therapy because of those type of, influences that I had in my life. And so when I graduated from Wayne State and then I went on to grad school, I wanted to be the best physical therapist clinician that I could be, spent a lot of time, effort, and energy in that, and worked really hard and did extra clinical, extra residency rotations, and went through the osteopath continuing education program, and went through the postdoctoral training at Oakland University. And in those experiences, I had the opportunity to work with some world-renowned manual therapists. So I worked with Olaf Evjen from Oslo, Norway, and Philip Greenman, who started the osteopath program at Michigan State, and Freddie Kaltenborn from Germany. And I would say they are the top 3 of the top 5 manual therapists in the world. So going through those programs, kind of that next phase was I was asked to stay on and actually teach in the program. So I taught in the program at MSU as well as Oakland for over 6 years. And what better way to learn than to actually teach your skill? So I taught for several years and was a resident instructor. Kind of that next phase, I then, looked into more political, how could I make a bigger vision or impact in our state. And so I actually was appointed by 2 different governors and sat on the State Board of Physical Therapy and drafted the rules set by which all physical therapists practice currently in the state of Michigan. So we added continuing professional development requirements and past direct access, some things that hadn't been done in 22 years. And so that was empowering to me. And then kind of that next phase of the entrepreneurship and starting my own practice and growing a practice and growing an influence within our organization and within our community and within the country. And I've been recognized by Ernst & Young as one of the top 10 female entrepreneurs in North America. And I've had the opportunity to go to Palm Desert with some amazing entrepreneurs, like the best of the best.
Yeah, I think I saw
that was exciting.
You had something on social, but yeah, I mean, that is an incredible acknowledgement and reward to be recognized in the top 10 across the country.
It was quite an honor. Yeah. And we don't do this for awards, but it is nice every once in a while. Yeah.
And not only you're fantastic in your field, but walk us through your business and before we jump into some of the other stuff. So you have multiple locations now. So walk us through that a little bit.
Yeah, so we have 5 locations at Peak Performance across the mid-Michigan area, and we just launched into the Grand Rapids market. We've also had contracts with various colleges. We worked with college athletes and professional teams in which we've provided primary care, cardiology, orthopedic, athletic training services for professional teams as well. So we see, at one point we're under contract for over 800 athletes that we are covering anywhere from collegiate to professional. From that level. But we work with the general population too, those weekend warriors or, the arthritic type of things. So anywhere from an outpatient orthopedic realm are kind of where we fall.
So and you look at, so you're coming into this business, but what kind of imprint or what kind of, if you looked at your business itself, what did you want to make it different? How did you want to change it, or did you want to change it? When you designed, you got 5 locations. What do you want that to be? Maybe a little different, or add a little bit of this to it? Because I feel when I come into your facility, the attention to detail is fantastic. Mm-hmm. Very organized. Always getting a survey. Everything. It's not an accident.
Right. Yeah. And
so anyway,
and it's intentional. Yeah. Very similar to how you run your business. And if you don't know, then how do you make the changes? And that's one of the things. And so part of the reason and part of the story of why I started a business actually falls in, my grandmother had tremendous low back pain. And I saw lots of, she's a brilliant woman that had tremendous resources, but still got caught up in the system where it was like symptoms were being treated, but the cause was never found. And this was before I was in PT school and before. And so I wish now going back, I could have made that difference. And that's always been my burning why behind what I do.
So your driver
and so,
right there.
Yeah. And like you, we treat causes, not symptoms. And you can chase your tail all day long chasing symptoms. But if you never find the cause, you will always be festering with your symptoms.
And I think that's what you were really emphasizing with myself.
Yeah.
That we're, hey, you can almost do the splits. Doesn't matter.
Right.
That's not the problem. Not the problem that you don't have the flexibility in your hamstring. It's that your other areas are locked up.
Right. And is it truly your hamstring, or is your hamstring a symptom of potential nerve issue that's making your hamstring tight? So we can stretch your hamstring all day long.
Right.
If we don't address the nerve, then your hamstring will tighten back up.
Yeah, when you started doing some manual therapy, and I'm like, oh, okay, something's changed here. And so, like you said, I was just treating a symptom: stretch, massage, do this and that, all good stuff, but really was never fixing the source of the problem.
Yeah, for sure. Yep.
So we had this conversation. You and I spoke at Playmakers, and you came up and you started talking about an office visit. And I was making notes, and I'm like, this is gold information. So this is what we want our listeners, our viewers, to kind of walk us through a little bit about healthcare, because this is what you do every day. You're right in that mix of healthcare, what's being reimbursed, what's not being reimbursed, the whole list. So anyway, if you could just kind of walk us through that that hospital visit conversation.
Yeah, and I think we start with the importance of it, because when we look at healthcare costs right now, they're tremendous. And so we were just talking before this podcast, and some of the costs that are coming forward right now is that an average person out-of-pocket cost can be upwards of $12,000 per person, and we're looking at an average household of up to $50,000 a year in regards to cost and healthcare costs. So the money is a direct impact, and people and individuals within our community, our society, our country are feeling the cost of healthcare more and more and more, because companies can no longer bolster 100% of the cost. And so as we're looking at that, we need to look and see, what is our dollar giving us? What are we truly getting from our dollar that we're spending?
So let's pause just for a second. I want to make sure everybody got that number. So you're saying 12 grand a year, basically per person, or $50,000 per household per year spent on healthcare.
Which is tremendous.
So I just
when
want to
you
make
look
sure
at the
that
average household cost, is not much more than that. So you're looking at over 50%, if not up to 90% of an overall household cost being spent in some way, shape, or form on health, wellness, and medicine.
So I just want to make sure that was crystal clear to everybody how much money. So continue.
Yeah, and it's drastic, and that's why this conversation is pivotal and important to have. And so what we were talking about is the expectation of what your money gives you. And, oftentimes I think it's been because of the barrier of insurances, we haven't really truly understood the importance of the dollar in healthcare, because we never really knew how much it cost, because we would pay $5, $10, $15, $20, but we didn't realize that that was a tip of the iceberg as to what was actually happening behind the scenes. And so now we're feeling it more. We need to be educated. We need to be informed from a consumer basis.
So that medical illiteracy has never been greater, in my opinion.
Right.
And so now we're starting to see what's behind the iceberg.
Yeah.
And that's what you're saying. So walk us through an office visit.
Right. Yeah. So what I talked about, and kind of one of the things that I love to have this conversation is what a traditional office visit costs and what it truly looks like and how much of your time. Okay, so if you're thinking about going into, say your primary care physician, or you're looking to go into an orthopedic surgeon, or, anybody out there, a specialist, a physical therapist. So you're looking at that visit of upwards of $250, $300. And the average right now in the United States visit one-to-one is between 7 and 10 minutes, one-to-one interaction with the physician. And so what you need to look at is, what are you getting for 7 to 10 minutes for $300 for that time?
It better be a lot, right?
Yeah. So, and what we talked about is, if you were hiring somebody to do something for your family or your household or around your house, and they said, okay, I charge $300 for 10 minutes. What would your expectation then be? It would be dramatically different than what we're currently doing in the way that healthcare is being
So if
delivered.
you're paying a copay of $5, $10, $25, it's not so painful. But if you had to fork out $300 for a 10-minute visit, I think you'd have obviously a different viewpoint.
Correct. And that's what is happening. So eventually, we are all shouldering the costs of healthcare. So that is what's happening. The payout is happening. We may not be feeling all of it, but we're starting to feel a little bit more of it. So when you show up to a doctor's visit, think of it as a business meeting. And the most important business meeting that you can have, because if you don't have your health, what do you have? You can't work. You can't help your family. You can't be a part of the community. You can't give back. So it starts there, right? So when we look at the cost of a car or a washer and dryer, and we spend way more time saying what is the best and looking at different resources and different pricing, but do we really do that with our healthcare?
Yeah, the research is not being done, but
right.
We're definitely going to make sure we're going to get the best washer, dryer, or whatever.
Right, yeah. We're looking on, consumer reports, and we're looking at all that stuff. And,
right.
There's that data is out there, but we just haven't been educated quite yet on on how to get it and what that looks like. So, yeah, going to an office visit, like we talked about, it needs to be the most important business meeting you have of the week. So that means you need to have an agenda. You need to have your questions, and you need to make sure you understand the conversation, because physicians, physical therapists, people in medicine don't realize that they're using jargon and terminology because they use it all the time, and that they don't realize it's jargon and terminology you don't understand. And people oftentimes are intimidated to ask, like, could you clarify? Or they don't think that they have enough time to get clarification. So you would be surprised the people that come into our office that have had major surgeries. And you'll say, well, what happened? Well, I had back surgery. Well, I understand that, but what happened? Well, they fused my back. Well, what level? I'm not sure. You should know all of that stuff. Like, you should know what they use, the kind of hardware they use. You should know what level they fuse. You should know the prognosis. That kind of stuff helps you get better so much quicker. And we see it in the literature across the board.
So when they come in, so you're going to map out, like, okay, so these are the things you got to walk in. Would it be 2, 3, 5 things? Because again, sometimes you're not going to get the time, correct?
Right. Yeah, and I think that's realistic. I mean, you don't want to sit down and monopolize, 2 hours. That's just not going to happen. That's not going to happen. But you know the time restraints on what a typical visit is, and sometimes it's important for you to ask, how long will I have with the doctor? How long will I have with the physical therapist?
Yeah, that's a great question.
Because if you don't know that, and you go in and you're thinking you have 20 minutes and you have 5,
right?
You're taken back, like, wait a minute, I didn't get my questions answered, right? So being prepared is pivotal.
And you got to go in with a plan. And now, when you were talking about this, when I heard your talk, sometimes that's not on their agenda. So it's their agenda, but versus your agenda. And that's what you're trying to flip the switch. It's like, it's the business meeting, and you need to come in there prepared for your business meeting, correct?
Right, yeah. And it should be your agenda should be their agenda at the end of the day, right? And so we talked a lot about developing your healthcare need and your healthcare team before you need them, so that you have the individuals that you can go to, not in crisis, not in the ambulance on the way to the hospital. You're trying to find, the best orthopedic surgeon because you just fractured your hip, or because you just had a stroke. You're trying to find the best, pulmonologist or whatever,
right.
Neurologist or
What's
neurosurgeon.
Interesting, like you're saying that. So, for example, I was just speaking in Houston a couple weeks ago, and people were asking me different things, and I said, well, I have this physical therapist, I have this chiropractor, I have a team.
Yeah.
I have a massage therapist. Well, you do. Why do you need that? I'm like, what are you talking about? Of course I need that.
Yeah.
So everybody, you want to surround yourself with expertise that can help you. But sometimes I think in our world today, like, a big job, and I know it's a big role you do, is when I sit down and we're doing private training or whatever it might be, I kind of help them map out what their team looks like.
Right.
And they never thought of that before. I'm like, well, you need to go see, this physical therapist, or you need to go see this chiropractor, or you need to see this family practice doc, or whatever it might be.
Right.
But they don't think about that. They wouldn't. If they had any other business thing, they would have everybody around them helping them.
Right. Yeah.
But not about their health.
Their health and wellness, right? Which, again, we bring it back to the most important thing, because if you don't have it, you can't do any of this stuff well. Right.
So what do you see some of the roadblocks and challenges in the healthcare field right now? What's changed a little bit in the last, 5 years for you? Is there anything really drastically changed? Because I know it has for me.
Yeah, and healthcare especially the last 3 years, has changed drastically in regards to when we're looking at overall reimbursement declines, overall costs of education costs are going up drastically. And so unlike, we're looking at like maybe a consumer type of model where you just increase inflation, or you increase your rate, or you increase your product, with healthcare, it doesn't work like that. And so you're feeling more of a crunch. And so what's happening from a consumer standpoint is they're getting less and less time and face time with the actual professionals. Because in order to, kind of overcome that, there's only so much time in the day, so you need to increase the visits in the day to make the difference, to continue with that margin. So education costs, which means salary costs, are up, reimbursements are down. There's only so much of that we can do. And one of the big things that we're seeing right now is hospitals in regards to nursing and travel nurse costs versus staffing nurse costs and supply and demand. And we're seeing a huge issue with that, and we're seeing some major changes as things are flowing through for the hospital systems.
Do you see, like, for physical therapy, is it harder to find good physical therapists today than it was 5 or 10 years ago?
Yeah, and I would say not necessarily the quality that's coming out, but the quantity has been decreased.
So the quantity
So
has been decreased.
programs right now are in jeopardy of losing credentialing because they don't have the educators, they don't have the staff. So they're going from a program that was 65 to 70 doctors of physical therapy that they're graduating to 30. And so what we're seeing is as our Medicare population, as our population is aging right now, our baby boomers are needing more and more care, we're seeing actually less and less educated healthcare professionals graduating. And so we're starting to see that crunch as it's coming up into
getting
that.
Smaller. Yeah.
Correct.
So let's switch gears for a second here. So what are some common things that a person listening or viewing this, my knee bothers me, or my back bothers me? Well, just take some kind of, pain medication or whatever. So
Right.
What are some of the first steps people could do, or what would be the strategy they would do if they started having my neck's killing me, or, whatever it might be?
Right. Yeah. Yeah. So one of the things that we look at is, appropriate triage, so that when we look at the overall cost of healthcare is that we can get the absolute best result with the minimal cost in healthcare to the individual, right? Because overall, that gets us healthier because they're actually getting treatment, but it also decreases their overall healthcare costs. And on a grassroots level, that's how I feel like we can start to make changes in healthcare.
Correct. Yes. So give us a couple examples of that. So
Yeah.
somebody has, my back's bothering me or whatever it might be. I get this every day, and I'm like, you don't need to. You need to start doing X, Y, Z before you do that.
Right. And so I will use the analogy of the food pyramid. So think about the food pyramid, what it looked like 20 years ago. Probably inappropriate to really the way that we should be eating when we know the
Right.
effects of the health and wellness based off of the food pyramid.
Yeah,
right?
for sure.
Same thing with triaging in our healthcare system right now. So if you take that pyramid of triage and say you have back pain or you herniated your disc, you were out in your yard or you picked up something and you herniated a disc, you have immediate pain in your back that's shooting down your leg. For those of you listening, what are the first thing that you would probably do? Pick up the phone, maybe call your primary care doctor, or if it's bad enough, you'd go to the emergency room.
Sure.
Right? Emergency room is the highest cost that we could do. But when you're in that much pain, you're
Yeah.
like, cut it off.
Right.
Like, I mean,
Doesn't matter.
I can't function. And trust me, I've been there.
Sure.
I've
Right.
been there. I've lived through it. So I understand that. But when you go to the emergency room, what happens is this is the triage that happens. You go to the emergency room, you'll probably get some test and measure. So you'll get an x-ray, radiation, an MRI, magnetic viewing of your back. You will be put on muscle relaxers and pain medications and typically narcotics, a Vicodin or Norco or something like that, right? From there, they'll say follow up with your physician if you're not better in a week or two. So then you follow up with a primary care physician who you're still not better, will then potentially send to a specialist where you may either get injections or more pain medications. Okay, so next tier up.
Yeah, this sounds really good.
You know,
Keep going.
from that next tier, you're getting the injections, which are extremely costly. So now we're looking at, probably about a $15,000, $20,000 cost of emergency room MRI, x-rays, primary care, specialist injections. And then you look at, from there, those don't work. Then you're going to get referred to surgery. You're going to go and have surgery, and then the surgeon will refer you to physical therapy. So we know if we take that and flip it upside down, right? So you go in to a musculoskeletal expert, and I'm not saying that not everybody, that there's not some people that need injections and surgeries and that kind of stuff, because there is people that need it, and I'm not anti that stuff when it's necessary. So you flip that, go to a musculoskeletal expert. What that would look like if you walked in to see me would be a thorough evaluation of how your spine is moving, what nerve and what disc specifically is involved. So you may have a series of herniated discs or bulging disc or arthritis, but I can tell you which one is causing you the pain without an MRI or without an X-ray. So I can tell you if you're a candidate for surgery based on a numerous different tests and measures that I do. So we call them myotomes, dermatomes, and they all back up. Reflexes, they all back up to the specific nerve, the specific disc, and the specific movement of your spine. I can give you treatment immediately to decrease the inflammation. We can work with you to get decrease inflammation, decrease irritation, and increase, oxygenation to the area and overall stimulation of healing right away through nutrition, right? Which is just a tiny bit of the cost, right? You can come into physical therapy for 12 to 14 visits for almost half the cost of a spinal injection.
For one injection?
One injection.
That's craziness.
Yeah. So you flip that. Now, if that doesn't work, no harm, no foul, because you always want to give your body a chance to heal first. Your body's amazing ability to heal on its own. It's amazing, right? But you have to give it an environment to heal. And you have to stop what you did to get it there, right? So you flip that, you get in musculoskeletal expert, you work with some nutrition, you work with some supplementation. Now, if that doesn't work, then you can start to triage up the chain, which is more expensive, more invasive, more, things that potentially are going to be long-term lasting effects, but are significantly invasive. But when you look at the health changes, the physical therapy changes, those are least invasive. And long-term prognosis, research shows significant good prognosis in relation to surgery, injection, and all of that down the road.
Do you see, so from that point of view, do you see this thing flipping slowly? Or do you see
because what was starting to drive this is the pocketbook. People are feeling that. And when people have a direct effect, they have skin on their, skin off their back of what they're having to put into it, they are starting to demand better. They're starting to understand that, being caught up in the system and having, months and months go by without actually getting better, like that's not okay, because I'm spending thousands and not getting better.
And that's kind of what we've been seeing for a while is they get all this stuff up front, but they're not even starting with the basics.
Right.
And then I have to go all the way back to the basics. And when the basics, and then like I had a guy in here yesterday and was like, I'm getting this, I'm much better here, much better, and it doesn't cost, the cost is, hardly anything.
Right.
So, but we're working on mobility, some flexibility, some balance, better nutrition, hydration. You got to pay attention to your sleep. I mean, the list goes on and on, but, you're flipping this model on end versus, okay, here's your meds, here's this, here's that, and the list goes on and on. So
well, and you talked a little bit. I mean, we talked a little bit about your team, right, in your healthcare team. So I find it interesting working with professional athletes. Everybody wants the results they have, but they don't understand what's keeping these people going. Every one of them has a tremendous team that they're working with.
Correct.
They do have a team. It's not like they get hurt and they just miraculously get better. And they have
What's
a team.
What's wrong with me? Why don't I?
Right. They have a team. I mean, when I worked with professional hockey team, they had a timed nutrition. I mean, what they were putting in their mouth was timed. Like before they walked on the ice, during half, kind of inner periods, what they got afterwards, from natural cherry juice to stimulate the melatonin, to 90% Keiko before to stimulate, the exercise, to all of that stuff. So when they get hurt, their body is primed to heal. So whether they need surgery or whether they need, they can recover quicker because they're primed to heal.
I remember you were working on my back and my hips, and then you were talking about, like, you could tell, like, my left side would fatigue much faster than my right. And instantly, and I could see that. And I'm like, wow, that's really fascinating. And then more you opened it up, it didn't fatigue as much, and I could think, well, here I'm playing paddleball or whatever. No wonder after I play for a little while, all of a sudden my leg's not reacting the same way.
Right.
And
Yeah.
it never really hit me like, what's going on here? But you woke me right up and like, let's start with that. If I didn't start with that, then I would have never fixed the source of the problem.
Right. And that goes down to, I think, finesse, right? So your test and measures that you do have to be finessed. And the higher the level or the better in shape people are, the more finesse you have to have, because it's minutia that makes a difference. It's a difference of less than 1% of difference when you're working with an athlete or somebody like yourself that's in really good shape.
Yeah, you started doing some simple things, and I'm like, but like I said at the beginning, my back is, I was getting up in the morning. I'm like 65 years old, and is it really, should be this hard to tie my shoes?
Right.
But
Yeah.
it's not. So,
right.
But at one time I'm like, gosh, I think I'm doing a lot of good stuff, but I needed a team, and that team has helped a tremendous amount. So that's kind of, I look at when people come in, like how you have to slow them down. The challenging thing is how do you find these professionals?
Yeah. And that's hard. But, engaging like with individuals like yourself, because you're very ingrained in the community, and who, kind of are the individuals that are open to educate and are open to,
Yes.
Really engage their patients.
Well, I
That's
like
key.
what you just said, open, because, we have this health professional, the green zone thing, and we bring all these health professionals in. I want to invite you to get involved in that. But
Yeah, I'd love to.
it's funny that everybody's kind of checking their ego at the door, and it's like, no, I want to learn more.
Yeah.
When I came to see you, I learned more about some of these things than I have my whole entire life, and I've been around a lot of people. So it really is. If you're more curious and you're asking good questions and you're open, I think and then put some time and energy into your own health. Which again, you're looking at a refrigerator or a pair of shoes or a car, and we're spending a lot of time in researching what's on Netflix versus what are we doing from a health standpoint?
Right.
Because medical illiteracy's never been higher along the way. So.
Yeah. No, I would agree. I think that is a crucial component of, really making sure that you're having that conversation. And something that we really take to heart within our organization is humbled confidence, is that, you're confident in what you do, you're confident in your background, but you're humble enough to know that, and anybody that knows that is high level in what they do, that's just the tip of the iceberg. The more you know, the more you realize you don't know.
Yeah.
And so you need to be just driven by continuing to educate.
I like humble confidence.
Yeah.
Because you want the confidence, but at the same time, you don't want to feel like, I look at some of the stuff I used to talk about nutritionally like 30 some years ago, and I'm like, what was I thinking?
Right.
What was
Times change, and that's okay to educate, right? Yeah.
What's going on? Why did I say? Why did I think that? But in many things, you just try to keep sharpening the saw along the way, and still have some principles. But I like that humble confidence. So
but if you were still talking about the things you were talking about 30 years ago, you would be totally irrelevant.
Yeah.
Right? I mean, so
I was.
Those are the things that it's
kinda.
like, if you're not, like you said, sharpening the axe, like that, I would expect that when I'm working with somebody, that not like they're total 180, but that they are definitely staying up on it. And if the same stuff they talked about then, they're talking about now, you're wondering, are you staying up on the latest and
certain
greatest?
things. I used to get in trouble when I worked at the Michigan Athletic Club, but one of the things I remember back in the day, I would talk about eating healthy saturated fats, and there's no such thing. I'm like, well, sure there is. There's coconut, and there's all nuts and seeds have some form of healthy saturated fat, but
avocados.
Yeah. There's a lot of
lots of healthy.
But I look back at the time, I'm like, you can't talk about that because fats are fats. I'm like, no, fats are not fats, and saturated fats are not saturated fats. I mean, they're all uniquely different compared to the source. So. Yeah, you do learn along the way. You look at some of the mistakes along the way, and then you look at some of the stuff that you talked about that really hasn't changed, and some of that stuff hasn't really gone out of style.
Right.
So what else would you like to share? I mean, I know, like, sometimes I'll hear you on Tim Stout's show, and you got some gold nuggets I listen to, and I'm like, wow, that's interesting. I never thought about that. But is there anything you want to share as we kind of wind down?
I guess I would just say is, from a health and wellness standpoint, we we talk about, the effects of exercise, and we talk about the effects of pharmaceuticals and diet, and all those three components are extremely important, but also sleep. And I think we really underestimate the fact of sleep. And, you and I talk about that. We were talking about it this morning. But right now, when we look at statistics, we could say that almost 80% of our current population is not getting enough REM quality sleep and developing into the deep sleep that they need. That is where we recover. That is where we get the turnover. That is where our hormones regulate. That is where all of this kind of rejuvenation is happening. And so, we can talk about health and wellness, and we can talk about, but if somebody is coming in fatigued and exhausted and, from a hormone level, they're just out of balance because of their sleep, we have a really difficult time getting people to where they need to be. And so sometimes it's just as easy as to get 8 hours of sleep. It's crucial because all this other stuff can be minutia if you're not recovering on a regular basis.
Well, I was speaking at this MIT conference in Boston, and I ended the presentation about being intentional about your rest.
Mm-hmm.
And it must have hit a nerve because I got a ton of emails after that. And what you're saying is, it really gets back to some basics. Are you drinking enough water? Are you getting outside and get some sunlight?
Yeah.
And most importantly, are you getting a good night's sleep? Because if you're not getting good REM sleep, you're not going to have a healthy brain. If you're not getting good deep sleep, you're not going to recover. Your hormones are not going to be right. But it's interesting that I'll hear people like, I want to hack this and hack that. I'm like, no,
Yeah.
you can't hack your sleep.
No.
And you can hear all the social influencers talking about that. But the bottom line is, if you're not getting a good night's sleep, everything's going to go bad.
Right.
And so,
Yeah.
like you're saying, let's just start with some basics.
Yeah.
If 80% are not getting enough sleep,
right,
walking in your office that probably 8 out of 10 are in that situation.
Struggling. Yeah. And so you're looking at increased anxiety and increased depression and increased, lethargy and increased weight. That's all directly related, So we can have all the fads in the world, and you can have the ketosis, and you can have all the, the crazy things. And I look at those as just fads, because at the end of the day,
mm-hmm.
they will come and go. And we've seen the cycle, and you've been in it long enough, and I've been in it long enough that we've seen it full circle, where they've come and they've gone, and then they're back again. But at the end of the day, the things that really matter are eat well, sleep well, and exercise.
Mm-hmm.
And it seems so simplistic, but it's so necessary for everything.
And if I sit down with a client, you sit down with a patient coming in, if you really go into the weeds, you're seeing lots of holes.
Mm-hmm.
They don't have a lot of space in their life.
Yeah.
Their life is so, fast paced. They don't have enough time to get a good night's sleep.
Mm-hmm.
And everything's hurried. And then they're going to load up on caffeine to get them through the day, or an energy drink, or all of the above, some kind of stimulant.
Yeah.
They're going to eat crummy because they don't have enough time to plan. And then you can see it's really starting to fall apart. When reality is, let's just step back for a second. Let's build a couple of habits at a time. But I think the big thing, what you just hit me with, is the first thing I really talk to all my clients about is, balancing the nervous system.
Mm-hmm.
Because if the nervous system is imbalanced, nothing's going to be in balance.
Right.
And that begins with getting enough rest and sleep and breathing and all that kind of stuff that goes with it. And if you're not doing that, and you're going through, and you're not going to have the outcome they would if they're going through the therapy and all the stuff great stuff you're teaching them.
Yeah.
And I just got back from Colorado skiing, and one of the things we were talking about in the morning is really giving yourself a little bit of time. It doesn't have to be an hour moving your body, but it could be 10 minutes. But that all kind of adds up. So when you look at the sleeping and the moving and the hydration, the eating, and all that stuff starts to build up over and over and over. But I truly believe, like you said, 80%. That is a crazy number.
It's huge.
And then when I'm looking at an audience, or you get, it's like, okay, I know most of these people aren't sleeping.
Yeah. You're doing lectures, in front of hundreds of people. You can assume that half of them are fading off because they're so tired.
Oh, yeah. I try to be energizing and engaging, but sometimes it doesn't matter. They're out.
Right.
Doesn't matter.
They're like, I have got no rest.
I have no chance with this crowd right now.
Right.
So,
Yeah.
All right. So anything else we want to end with today? Anything you want to share with them as we wrap this up? But this has been really, I mean, you're just a gift to this community.
Thank you.
And you've been I got to tell you, you've opened my eyes and how my body feels. And I want people to understand that don't give up, because the human body, as you mentioned, has an amazing ability to heal and self-correct, but sometimes you might need a team around you to help you figure that out. And nobody has to cross these bridges alone. And so that's what I kept thinking. And people said to me, why do you have all these people around you? I'm like, because I don't know this stuff.
Everybody needs a coach.
Right. I need a coach. And
the best of the best.
Right. And if I feel like I know everything, I know nothing. So.
Yeah. 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 So, I would just leave individuals that it's when you're looking at health and wellness and movement and physical therapy and nutrition and all of that, it doesn't have to be daunting, but you do have to start. So I would just encourage everybody that, today, just start. Simple. It's a simple habit that you can do. And if it's going to the gym or if it's eating right, you can just go to the gym. You don't even have to work out. Just start the habit. Go there and then leave. But start the habit, because showing up is the first part of a huge change. So show up until you're ready to work out, and then eat, small changes, small changes in your sleep. Set your alarm at a certain time to go to bed, small things. It doesn't have to be huge. Park at the back of a parking lot instead of, driving around for 20 minutes to get the front spot. Little things make huge differences. So I would just encourage everybody to start now.
I like the word show up, or 2 words, show up. So
show up and level up.
We're going to show up and level up this year. So anyway, thanks for spending the time today. I hope everybody got some out. I definitely got a lot out talking to you over the years. So again, thanks for taking the time today, and we appreciate all you do in this community.
Well, thank you so much. It's been a pleasure to be here.